So this is a video on myofascial pain syndrome. Uh, it's something that, as a massage therapist, you're going to treat a lot of in your career. Um, it's uh, a very, very broad demographic. Probably most people at some point will suffer from some degree of myofascial pain. It's saying the precise incidence is not known, but it's freaking high. It's a non-reportable thing, and it really isn't, to most people, critical enough to do anything more than maybe bitch to their spouse or their coworkers about it. Uh, but they do seek help from chiropractic, from massage therapy, from physiotherapy, from the modalities that seem to work for it. It's on page 708, 709 in your book. Um, and really, what it is an overuse of muscle stress syndrome. Uh, and what you get are trigger points. Um, and there's a lot of different ideas as to what trigger points are. But really, it all comes down to the same thing. There's some sort of an injury that that creates a hyper irritable spot in the skeletal muscle or in the fascial components around that muscle. You get this pattern of referred pain that's typical and maybe quite distant to the point that the tenderness is at. Now, this is a far different thing than the tender points of fibromyalgia. This is a problem right in the muscle. Now, they can be found right at the neuromuscular junction, right where the motor neuron meets the muscle fiber. It can be at where the tendons, either of origin or insertion, attached to the periosteum, right at that point, where basically the muscle joins bone. It could be a problem of collagen, but generally speaking, we normally think of them as this central trigger point at the neuromuscular junction. And they become like this sustained contraction. It's a so they can be either active, causing pain, or latent. They're not painful, but they cause restriction of movement, weakness of the muscle. The latent ones, the ones that people don't even know about, and you'll hear clients will say, "Oh, I didn't even know that hurt until you got on it." They can become active when you strain, when you do something with it. Sometimes when there's trigger points in this sustained contraction and they last long enough, you start getting them in the synergist muscles to where the main trigger point is, and we call those satellite trigger points. They'll happen because of overwork of a synergist muscle that is trying to compensate. So this contraction causes a little knot. And that at that knot you end up with some ischemia, and when you get some ischemia, you don't get enough ATP, and the contraction stays. Like there's almost a rigor can happen locally at those sarcomeres. You get chemicals released, the muscle tightens, there's more signals, the motor neurons overfire, they release acetylcholine, and you can't get the acetylcholine esterase to take it away, so you get this sustained kind of almost tetanic contraction at that point. They don't know what really causes it, but they think, and this is actually a slide of some referred pain. Um, they think it's sudden overstretching will do it, some direct trauma. But then again, stress will do it, physiological stress and psychological stress. Postural faults, some people have a short leg, and that causes imbalances in muscles, which then can cause this myofascial problem. Uh, Repetitive injuries are often this. So a lot of workplace repetitive strain injuries will end up as this. It seems to happen in people that are fatigued, that have um, chronic pain or impaired sleep, nerve entrapment syndromes. So people with herniated discs often get these secondary to the nerve entrapment, uh, etc. So uh, multiple causes. There's probably as many causes as there are people that have them. But it all comes down to the same thing. And I know already, and by third semester, you've already encountered trigger points in clinic. So what are the signs and symptoms? These are taut bands of muscle. It's that ropiness that you feel in the muscle. Sometimes you feel them as little nodules that are really exquisitely tender. Uh, and then they get this reproducible referred pain pattern. Uh, you know, I've had them. I get them in my levator scaps and a lot up in my shoulders, and when they get worked on, the pain just kind of shoots right into the side of my head, into my jaw. I end up having to clench my teeth against the pain. But yeah, the pain far outweighs the seriousness of the problem, or even the place of the problem. So you feel that there's a taut, palpable band. Uh, Almost everybody has them, so there really isn't no criteria for diagnosis. It's kind of you find them incidentally when you're working on people. You work them out, and that's it. That's it. Now, there's been all kinds of different treatment options that have been explored. Um, when I was in school, the big thing was this vapocoolant spray. It's like an aerosol uh, cold spray that you would spray on the area, and supposedly that would bring it down. It causes vasoconstriction and breaks the cycle. Um, I, I've got a neighbor who's an MD that works at a pain clinic, and he directly injects into these spots. I've heard of Botox, dry needling, not so much. One of the massage therapists in my clinic gets great results with acupuncture. She's an acupuncturist. So I don't know. There's lots of things. Usually, the way that I deal with it and the way that you'll deal with it is that sustained pressure uh, on the uh, on the site. Now, it seems counterintuitive if the problem is primarily ischemic to cause more ischemia, but somehow it seems to work. So I'm sure that you will encounter a lot of it in clinic. You'll encounter a lot of it, and you will talk a lot about it in technique class. So very straightforward myofascial pain.